Fantastic. Good to hear. So welcome everyone to the 2024 Frontline Network Annual Conference. I'm James Ingram. I'm the Policy and Best Practice Manager at St Martin in the Fields charity. Very fortunate to be here to introduce the day and to talk through some of the overarching themes. I'll run through some things around the event, the schedule. There'll be a couple of icebreakers, which we'll try and deliver virtually. Let's see how that works, just to get to know a bit more about people, where you're coming from, and the, I guess, aspirations for the day, and just how you're feeling in the, the context that we're all operating in. Then I'll give an update on our work, our plans, our impact at St Martin in the Fields charity. So, as you know, you can join for one session or the whole day. All sessions are being recorded as webinars and will be shared afterwards via our website. And throughout the day, please do get involved, sharing comments and questions in the chat and Q&A box. And for all of the sessions that are being chaired, the chair will refer back to the questions as they kind of roll in. And we really want those views, experiences, questions and prompts to come from the audience, and we'll be channeling those in to ensure that speakers can appropriately respond to them. We want this to be as participatory as possible. As you know, schedule for the morning, it will go straight from this introductory session into a roundtable with representation from all four nations. We'll have a break, 11:30 to 45. Then there's three different options: the health, inclusion and exclusion roundtable, accessing legal advice for people experiencing homelessness, and universal credit, managed migration and beyond. We'll have a break, 1 o'clock to 1:45. In the afternoon, wellbeing roundtable. You'll see me again chairing that one. We'll have a break until 3 p.m. And then four different options running concurrently for the final session in the afternoon: the impact of inequality on mental health and housing, led by MAC UK and their approach to working across multiple systems; children and families in temporary accommodation; understanding hoarding; and system leadership with me, making every adult matter. We are delighted that we've got 624 people registered for the whole day. And it looks like there may be around 250 odd people online now. So welcome everyone. We've got a couple of things on Menti. So I'll give everyone a minute to be able to log in. And yeah, Nick, thank you for introducing yourself. If people feel like putting their name, organization, role in the chat, that's great. We'll move on to Menti, which is the first question is, where are you in the UK? We should be able to then display that on a map. Of course, we at St Martin in the Fields charity operate in a very inclusive way across the four nations. And so we'd love to see where everyone is, I guess, beaming in from. Give you another minute to respond to that, aware that people will be logging in for the first time. We'll have 3 questions across Menti during the course of this opening session. It's really fantastic to see the spread across all 4 nations, but also the concentration clearly in a number of major cities and towns, but as well as into rural areas as well. And that's really, it looks like the spread is, maps very clearly across the respondents that we had to our Frontline survey this year, that I'll be running through the findings and analysis shortly. Thank you everyone for that. The next question for Menti is to, if you can, tell us one thing that helps you to get through a challenging day. When running through a practice of this with the team, quite a few people did say chocolate, quite a few people did say ice cream, but there were some other things around kids, computer games, as well as some of the more, how should I say, work-specific things. It's brilliant to see that. It's coming through really clearly on my screen with the analysis that colleagues matter a huge amount. That peer support is something, again, that comes up really strongly in the culture across organizations in our findings of our Frontline survey. Having a break outside, I hope that you're able to do so with the breaks that we've got built into the day. I like making a whole pot of tea, same as drinking probably multiple cups of coffee, going for a walk, dog, comedy. It's great. We'll share all of this with everyone. It's helpful to understand not only the motivators, but about what it is that helps you, because we know we're not evergreen to this, that a lot of people have had a lot of challenging days over the course of the last few years at work and beyond. So thanks everyone for that. I'm going to move on to an update from our organisation, St Martin in the Fields charity. The Frontline network is, of course, what many or most people here will be familiar with. We support workers across public, statutory and voluntary sectors through funding, community and resources. The Frontline network is composed of our local networks, and that's local to certain geographies. That's also local to a number of themes. So, big shout out to representation that we'll have here from Cyrenians, from Cymorth Cymru, Homeless Connect in Northern Ireland, Just Life, Praxis, who deliver the Pan-London Migrant Frontline Network, Street Life in Blackpool and beyond, Coventry Citizens Advice, and Basis Yorkshire, who work together with Together Women and Leeds Women's Aid on the Women's Homelessness and Housing Frontline Network. We do a lot more than as St Martin in the Fields charity than the Frontline network. One exciting thing for the Frontline network is that we're just developing the first theory for change for the group, and that's really exciting, and it shows a number of years of work that's gone into collaboration across the group. We, as St Martin in the Fields charity, our vision is that everyone has a safe place to call home and to access the support they need. Our mission is that we enable frontline workers and those they support to work together to find and keep a safe place to live. Those who are allies of us will know that we've had some changes in our leadership recently. Tim Bissett, our CEO, after 11 years has moved on. We're very excited that in 4 days' time, Duncan Shrubsole will be joining us as our new CEO. We'll have a new director of income joining us as well. And watch this space, not to be poaching anyone, but we've got a lot of new roles that are going to be advertised over the course of the next few months as we grow. So as well as the Frontline network, we base everything on our values, about being collaborative, about having perspective, and that's seeking people's perspectives, and to act with integrity. As well as the Frontline Network, one of the really big things that we do is our grant making. So there's grant making through the Frontline Network. There's also grant making beyond. Many of you will be familiar with the Vickers Relief Fund. Around £2 million a year goes into that. Our annual appeal last year, or ending in January this year, that brought in around 4.3 million. Around 3.9 million went out the door to fund individuals and organisations. The Frontline Fund, the Mental Health Frontline Fund, the Homeless Practice Incubator, support to, of course, the connection at St Martin in the Fields, as well as research and piloting on personal futures and cash transfers and well-being as well. That's a big part of what we do. Our theory of change, this is new as of this year. All these slides will be shared, aware that that's a lot of content to be communicating, but this is the way in which the organization now, through its innovation, through our consolidation of everything that we've learned and everything that we've listened to from people attending these conferences, from people participating in our other events, training sessions, engaging with the leads of the Frontline Network, and those people who have been in receipt of funds through the VRF, the money that's then got on to people experiencing homelessness themselves. We are working in a deeply participatory way, ensuring that our funding is learning-led, channeling really best practice and effectiveness, that people experiencing homelessness are able to access effective support. And to speak to my area around influencing, is that there's greater support for solutions to homelessness. Our training program, people will know about the training fund. We've diversified and grown, we've listened, we've learned, we're now doing more of what people have asked. There's outsourced training. We offered 6 times more outsourced training sessions than the previous year, so from 6 to 38 on areas from psychologically informed environment, immigration, housing legislation, and welfare benefits. We now part subsidise level 3 accredited training with our friends at Homeless Link and the Chartered Institute of Housing, and we've increased the upper limit available for group sessions and individual grants. What I really want to say on this, and this is, I may be talking until I go red in the face, because I just really want to say that it's something, values-based, something about our attitude and our practice as an organization, that we are listening and we are learning from you constantly, as well as obviously the feedback forms from the day-to-day. We want to understand how we can better increase reach, support more staff to access more and better training. The developments for this year are based on what we heard from people participating in our activities and in the conference last year. So expect that this time next year, you'll see a lot more responsive innovation. And certainly we hope that we'll have more funding available than that we've brought in, that we can share to ensure that the sector is stronger, that the sector is healthier, and that people are better able to do their jobs in the environment that they're in. Got a question now. Following up on that, is there one training on a theme or a type of training that we could provide for you? And what would it be? I'll give you a couple of minutes whilst we're waiting for the responses in. And again, this listening exercise, this participation, we will be acting on this. And that's a very firm statement of intent from us, that we take our guide from you. So please do share that in the chat or using Menti as well. So I'm getting in the chat about preventing eviction, around introduction and capacity building on influencing policy, on vicarious trauma-informed practice. We'll touch on that definitely in the headlines from the Frontline survey, on developing strategy, welfare benefits, so some about the changing external environment in regulatory and legal issues, some things around practice and priority needs. It doesn't surprise me to see that mental health first aid, preventing eviction are on there as well. It really speaks to the challenges that people are facing, not just in their professional lives, but personal lives as well. And I think that, you know, this is something that I think we're going to come back to again and again, is around ensuring that the trauma-informed care and psychologically informed environments that we attempt to create for people seeking support from services provided, that those are also available for staff as well within the sector. Thank you, everyone. That's come through really, really clear, especially around the legal elements and around priorities and about high need clients and trauma as well. It really touches on the complexities and intersections there. We're going to move on to our frontline worker survey. So this year was the 7th UK-wide survey. I say hot off the press. We're due to release the executive summary soon. So this is a privileged update and insight, because what we think is that many of the people attending today will have been respondents to the survey. We collected that data, as many of you remember, back in January and the beginning of February this year. We had over 1,000 respondents from charities, local authorities, and beyond, and across all 4 nations. One senior individual within the sector said of last year's survey that their reflections were how great the findings are, that we have the information to act on, how depressing the findings were, and how much it resonates with what they're hearing on the ground. Now, I'd like everyone to bear that in mind as well as we run through the survey. We want to improve how we're listening, and certainly what framing for the findings we're doing in order to act on what we learn. You know, we want to use that to improve our funding and our practice within the organization, but obviously we want to have that systemic change as well through influencing others, influencing funders, policymakers, decision takers, and we want it to be as inclusive as possible. This may not surprise many of you, and I think that this is the thing that everybody knows, but when you see it summarized, that's when there can sometimes be a shock. We know that everyone here knows, but what about those people who perhaps in positions of authority who could make changes to improve this context? What about some people who perhaps don't want to know these things? You know, it's something important to bear in mind. It's not just about collating the data and seeking all the testimonies, but about, you know, what we then do with it collectively as a sector, but then also in terms of our asks. 83% of frontline workers said there was an increased demand for the homelessness service that they work in the 12 months prior to us launching the survey. Close to 90% of respondents are supporting people who are at risk of rent arrears. And again, you know, 89% supporting people at risk of eviction. 86% of frontline workers supporting individuals who are currently sleeping rough. That obviously speaks to the complexities of large caseloads, but also mixed caseloads as well. We know that there are fewer housing options. close to 90% of frontline workers reported that it was difficult or very difficult to obtain private rented accommodation for the people they support. That is not even to speak to the results that the statistics that came out yesterday around the increase in rent costs yet again. 47% of frontline workers, a significant increase on last year, so their ability to prevent homelessness has decreased. And 92% of respondents said they found it difficult or very difficult to obtain suitable housing for the people that they're supporting. I see in the chat, how soon can we share these numbers? This is all on a, it's funny saying this is on confidential basis with 600 plus people joining, but we're going to be releasing these stats very soon. We know that it's a short lead into the general election, obviously on the 4th of July, but we know with this data coming out in advance of that, there is the evidence to not only call for change, but I think to hold whoever the new government is accountable in those first 100 days and beyond. And I think that, in our requests of a new government, but also in working with opposition parties in a very pluralistic and democratic way, this information needs to be acted on. It really, the statistics are so shocking that the moral demand is very clear. Of course, again, what do we know is the impact is not just on the services of people seeking support, but what is the impact on those who are supposed to be providing support, on the frontline workers themselves? More than half of people who responded to us said they're struggling to pay their bills at least some of the time. 40+% said they struggled to pay their own housing costs. 47% found them spending their own money on work-related costs, at least sometimes. And about half of the frontline workforce reported feeling secure in their jobs. Obviously, 47%, there's, the remainder felt that they did not feel secure or were unable to answer and felt neutral about it. One really big thing that I want to touch on is 51% of frontline workers said they always or often feel at risk of burnout. We're going to be talking around things in our wellbeing session later, but this really sets the tone again for the discussion that we're going to have in the panel in 7 minutes' time. 30% said they sometimes feel at risk of burnout. So 80% of frontline workers are in or at risk of experiencing burnout. That is very significant. And 64% said that they feel that their role has a negative impact on their own well-being. We have, as St Martin the Fields charity, made changes to our funding and our practice already. So although these statistics are yet to come out and be the basis for asking for and pushing for change, we as St Martin the Fields charity are committing to use our funding in a different way. So we are going to be distributing £2 million in small grants through the Vickers Relief Fund to support people in access accommodation to prevent eviction. We're going to be funding organisations to deliver mental health support for people experiencing homelessness. And we're also going to be developing a new fund to help overcome barriers. We've also got a number of recommendations. Some of those, they seem small and tactical around expenses. Some of them are much bigger asks. And I think that the point to that is that, as the futurist James Ingram said, is that any useful idea about the future should appear ridiculous. We know that from the state of things, as we've represented them in the findings of the survey, that there's a pretty bleak picture for many. And we want to ensure that we're covering as much ground in our funding, in our practice, in our convening of the network, and that the support that people require is shared and is out there, and that the big structural changes that we and other organizations are calling for in the run-up to the general election, but as has been on the agenda for many years, to ensure that that comes across loud and clear. Got one final Menti question, which is for those here, with the exception of better wages, because we know that that is an issue for many. If there was one thing to support your well-being, well-being of your team, the well-being of your direct reports, what would that be? We'd love to hear from you now, and I'll give people a couple of minutes to respond to that. It's interesting that as we start getting some of the responses in, a lot of what I certainly wanted to cover, and what comes to mind from what we found out from the listening to the frontline workforce through the survey, is that there's a lot of the parallels in control and feelings of control or powerlessness over people's lives, both at work and at home. And it's interesting to reflect on which of these things is achievable, which of these things it just takes a small change in funding in practice, and how much is structural or systemic. Looking at a 4-day week, we know that the trials have been have given us good data on that. Empathy is really important, effective management and good supervision, free counselling support, thinking around vicarious trauma and the knock-on, lower caseload. It speaks to the demands that people are placed under. Nice outdoor seating, that it counts for a lot. Well-being is not just about the mental health, physical health, but about having the headspace and being able to manage through the changes and challenges of work. Work-life balance, job security, funding infrastructure. Again, we can telescope between the very big demands and the things that the changes that we can make as individuals, the changes that managers can make, the changes that senior managers within organizations can make, and then the bigger things where we as a sector can perhaps marshal that data, that evidence, and certainly the testimonies, the human impact, to be able to say very clearly what we need and a pathway to how we can achieve it. I think, again, that's something that's really important, that's coming through loud and clear, is around dignity, around work not having a significant negative impact on people, and then about the extra pressures that people are under, given the cost of living and cost of essentials crisis, given in-work poverty, given the statistics that we found and heard about the number of frontline workers who themselves feel as though they're in precarious housing situations or at risk of homelessness themselves. Gratitude and better support from senior management, one that's come through on the chat. I think all of this speaks to, again, a more human approach, and I think this is where the onus for change. People are already very stretched, and individuals perhaps feel as though there's too much for them to be responsible for about changes to affect them. But as Liz has contributed, the person-centered approach, it's the peer support, it's the culture within organizations. And I think, across the sector, again, looking at wider pressures on civil society, on the voluntary sector workforce, but also, looking at how things are in other professions, in healthcare, in education, many people are under the same pressures. And I think there's a lot of learning from within our organizations, across organizations and across the sector. And, this is coming from the chat, our work being appreciated. I think that's really important. I want to thank everyone for the contributions there. I'm going to move on now to the Four Nation Roundtable discussion, set the tone for what we as St Martin the Fields charity have been doing, and how we're listening. I'm going to bring in experts from across the Four Nations to consider those in their specific context, responding to some of the key issues that frontline staff are facing. I'll share a bit more evidence and analysis from our annual survey. And crucially, home and hope are inextricably linked. We want to discuss the ways that we can collectively support one another and act for change. So I'm going to ask our expert speakers to now join us. And you'll see everyone starting to come online now. Welcome, everyone. Delighted to have you here for this first roundtable. An expectation, again, that everyone attending is going to keep on feeding in with questions for the panel. I will be referring back to those questions and ensuring that, with that participation, that there are answers and that there's discussion based on what you want to hear from our panel. First, though, if I can ask each of you to introduce yourselves, your role, and organization very briefly, and then I'll move on to asking an initial question of each of you in turn, and then we'll move on to some wider prompts and discussion. So, Nicola, if you may.
Hi, James. Thank you very much. It's great to be here. And as I said in the group chat, it's great to see so many people joining us this morning, and particularly people from the North and Northern Ireland. So, my name's Nicola McCrudden, and I'm Chief Executive of Homeless Connect. And we are a membership organisation. So most of our members would be organisations that provide services in homelessness. Most of that would be supported temporary accommodation, floating support, street outreach, etc. We've been around for about 40 years now. So we provide training, support, networking opportunities for staff and organisations. We also run the Frontline network for Northern Ireland, which we set up just a few years ago, but we've around about 175 members now. So touching on 200, I would say, hopefully by the end of this year. So we're very grateful for the funding to be able to provide that here. And we know that some of the events that we have run have just been amazing. We did one yesterday, which was like a roundtable kind of cafe style interviewing, speaking to each other, networking event, which went down really well. So we also work with people with lived experience. And we've been involved in that now for a number of years to get their voices amplified. We do policy and advocacy work, and we involve people with lived experience in that, and also people from the Frontline network. So we've had members of the Frontline network engaging with our assembly here locally. So we do that. We also provide a home starter pack service, which provides basic household items for people moving from homelessness into their social tenancy, so they can set up their home. And food and other items go with that as well. And we run Fair Share. So you might have heard of that. We run Fair Share for Northern Ireland. So we're part of the Fair Share network. Sorry, that was a bit long.
No, I love the detail, and I've been very impressed with what I've learned from you and your team, and the impact that you're having. Pete, if I can ask you next, please.
Yeah, good morning, everybody. Hi, I'm Peter Smith. I'm the Director for Sector Development at Homeless Link. We are the membership body for frontline homelessness charities in England. So a lot of what Nicola said, we do similar things, although we don't do fair share and things like that. But we're about to develop, inspire, support and sustain a movement of organisations working together to achieve the positive futures for people who are homeless or vulnerably housed. James, you described me and us as experts. I would argue that everybody on this call and the people that they work with are the experts. All we're merely doing is hopefully pulling people together to give them the opportunity to make a difference and hopefully get some kind of satisfaction from the work that they do, because everybody works flipping hard. and it is really appreciated. So from my point of view, my role, Director of Sector Development, is very much about workforce training, development, learning what works, what doesn't. You mentioned the practice incubator that we're really pleased to be evolving with colleagues on this call to learn from what's going on around the country. But that's it from me, I guess. I'm not going to ramble on. I'll do that later.
Thanks, Pete. And I think you touch on some really important points there around just the sheer dedication that people are working, the contributions that people make not only to their organizations, but how so many people go above and beyond in supporting those people who are accessing their services, when many frontline workers, as we know, find themselves in very difficult personal circumstances. Barely a couple of years on from the pandemic, after X years of austerity and underinvestment, with the housing crisis that we all know about. Thank you, Pete. Katie.
Hi everyone, my name's Katie Dalton. I'm director at Cymorth Cymru. We're the representative body for providers of homelessness and housing support services in Wales. So we represent about 80 different organisations, predominantly in the third sector and housing associations, but also have some local authorities as well. I usually describe my job as just shouting at the Welsh Government on behalf of the sector, which is a pretty good summary. But we're also really, really proud to run the Frontline network here in Wales, and it's one of the most rewarding things that we do actually. Here, we know that CEOs and managers do their best to represent the voices of their frontline staff, but there's nothing like speaking to frontline workers. And we've been so proud to run the network, and part of that has enabled frontline workers to have a direct impact on Welsh Government policy and legislation in a way that has never happened before the Frontline Network Wales existed. So really delighted to be here. And yeah, as has been said, you guys are the experts, but hopefully we can bring something interesting to the day. Thanks very much.
Casey, thank you. And someone using a bit more jargon might say it's about amplifying voices, but I think shouting often can seem like the only option. I'm of course, with my policy influencing hat on, really interested to get a view from people, from their organizations, from their different legal and policy and public affairs environments, also about what works. There's a whole load of tactics available to us, and change can happen in lots of different ways through lots of different means. But I think also one thing that you've spoken about, Katie and Pete as well, is about that feedback loop. It's not just about speaking out. It's about listening as well. Thanks, Katie. And Michelle.
Good morning. My name is Michelle Major. I am an impact lead at Homeless Network Scotland, which is the Scottish kind of membership organisation for people who work in and around homelessness. So very, very similar to my colleagues on the panel. We are based in Glasgow, but we work all across the country. And I think the jewel in our crown is the work that we do, providing a platform for people with lived experience, which is it's the focus of my work. It's, in my opinion, some of the most important work that we do, particularly with the All In for Change team, which is a partnership between ourselves, Frontline Network and Cyreneans, where we bring together frontline workers and people with lived experience of homelessness to influence change and kind of report directly to the Housing Minister in Scotland. So it's really exciting work, and I'm absolutely delighted to be with you this morning.
Thank you. Thanks, Michelle and all. The context in which everyone's operating, we know that 22% of people in the UK are now living in poverty. We know that rents have grown by about 9% in the last year. England is, to quote the Organisation for Economic Cooperation and Development, the most difficult place in the developed world to find a home. Record numbers of people are spending more than 40% of their disposable income on a place to live. I've mentioned before in the survey findings about 83% of frontline workers saying there's an increased demand on homelessness services in the last 12 months. And we know that things are tough. Nicola, if I can come to you first. I don't want it to be the elephant in the room about the political context in which and the diverse political context in which we are, of course, all operating. So if I could ask of you, how do you think things can change in the next 12 months? And how hopeful are you that things can change? With any specific examples about collective action, within the sector in Northern Ireland?
I think it's really challenging, if I'm going to be honest with you. And I do try to remain an optimist, but, you have to be a realist too, that, we haven't been building enough social homes. I'm sure that's the case across the nations. And that's caught up with us. And that's a major challenge, because what we're seeing is that the figures are going the wrong way. So in terms of the numbers of people who are in need of housing, the number of people who are experiencing homelessness and in need of housing, it's going like that. So here in Northern Ireland, we've seen 132% increase in the number of people living in temporary accommodation in 5 years. And as we know, that's a result, there's a combination of factors, but obviously COVID was a major catalyst for this. So there was we always talked about hidden homelessness. We knew there was people sofa surfing and moving about, but obviously when COVID hit and bubbles and all of that, people came into the system, and once you're in the system, you're in the system. You're not going to go back to where you came from. So my concern has always been that we've been underestimating the level of need for for a significant amount of time. And there's still hidden homelessness, so what are we doing? What are our governments doing to plan for that? So if we're not building enough homes, there literally is like a bottleneck effect. And what your survey shows is very much reflecting on what I'm hearing. So I've been going out and about and meeting people in services as part of our strategic planning process. And the burnout that frontline workers are experiencing is immense. And one of the main reasons for that is because I hear there's an increase in demand or need for temporary accommodation, but what we're saying is people aren't moving on because there's not that supply there. So it becomes increasingly frustrating and demotivating for staff working in services, because they don't see that move on. They don't see that result. They're not getting the pleasure of saying, well done, you got your tenancy, off you go, we're here to support whatever you need. And at the same time, what's happening in our jurisdiction and in others is there hasn't been the proper investment in mental health services, in addiction services. And that's not to say that everybody experiencing homelessness has mental health and addiction, but if you're living in supported accommodation, you cannot access those other health and care services, then you're in a very challenging situation, and we're seeing more levels of aggression, and that is understandable. And our staff are doing the best that they can to support people in terms of trying to manage behaviour. You're seeing increased use of polysubstance. You're seeing more levels of naloxone needed. So our staff really are like the blue light service. People are more on suicide watches, and trying to help save lives at this point. So that all sounds very negative, and our staff are doing an incredible job. We want to motivate them. We want to support people. And we don't want to lose staff in the sector, but we do need to see significant investment in building affordable social homes. And in Northern Ireland, what we've just had is a 27% cut to the new social house building programme. So last year we started over 1,500 new homes. And the budget this year will be lucky if we do 400. So that is the importance that our government is given to affordable social housing. And unless we tackle that, and unless we support and fund the services that are needed for people in services, it's a really challenging picture. But there is hope. And there are a number of projects here that are working really well that has that collaborative element to it. And one is the Complex Lives project in Belfast, which really shows that if statutory services and voluntary services come together, and if we can get pots of money from different, not just the housing executive, for example, here, we get bits of money and we have that cross collaboration, we can get people off the streets and put them into accommodation and provide the support services that needed. Because as we know, people work in silos and we need to break that down. So I can see a lot of nodding heads here. So I've probably touched on a number of issues there, James, but I do try to remain optimistic. But I think collectively together with people with lived experience, people on the front line, and those in leadership, we really do need to make housing and homelessness a top priority for all our governments. Thank you.
And I think one of the things that I'm really taking from there is about the sense of anchoring and belonging that that a home can give, and about the ability to, not only survive but thrive. To go from treading water to actually feeling as though you can flourish. And I think that the impact is across multiple generations. The consequences of the lack of appropriate housing, and about the commitment to at least start builds. Thank you for that, Pete. If I can ask of you how membership bodies, and looking obviously at the strength and the esteem of the network that Homeless Link has, how can membership bodies best encourage the participation of frontline workers and to work with them to mobilize, as Nicola said about lived experience. It's not just the lived experience of people experiencing or risk of homelessness, but about the lived experience of frontline workers as well, about their voices. How can membership bodies encourage their participation then to make change in practice and policy?
Well, I think we're all very, very fortunate in the sense that through our membership, we are all about building a collective movement. And I think, we have 800 members within England. We have obviously different size and scale. So there are a lot of frontline workers involved in this area. And I think what we need to do is ensure that, first of all, as a proactive membership body, we're going out about and hearing about experiences, as you've quite rightly said. It's the experiences of frontline workers. What's going on? Nicola mentioned what she's heard and seen when she's doing her visits. It isn't dissimilar to what we're hearing in England in terms of burnout and how people are feeling, and that thing around, again, whether it be social care or whatever, that there needs to be investment in. And I think it goes down to us as membership bodies to, as I say, first of all, listen. We've got to listen to what's going out there on the ground. Often people listen or only look at the data. Experience, and that experiential kind of work. We saw a lot of stuff coming through about person-centered, relationship-based. That's what people are about. Yes, that is what we're about. That's what this sector's about. And we need to really champion and use that as a strength, rather than it always just being about data. Actually, collectively, the data are individuals, and our frontline workers know that better than anybody. So we need to listen to that. We need to gather those experiences. We also need to act as a little bit of, the hopefully positive light in this area, because it is bloody hard for everybody. And if we can't pull that together and galvanize as membership bodies, and then pull out the good elements of things that are happening, then it means, unfortunately, the narrative that everyone is feeling is really tough. And what I've probably found more in the last years than I have in my entire career is that where in the past there used to always be a little bit of a chink of light at the end of the tunnel there, that you're thinking, right, yeah, that is a bit crap over there because of this, that, and t'other. But actually, there's always that as the opportunity that might be able to be utilised to do. You know, it used to be private rental sector, it used to be different things along those lines. Now, with all the changes that have gone on with everything, whether it be building, whether it be kind of commissioning, whether it be, as I say, changes to standards in relation to private rental sector and things that I'm not saying aren't needed, but also it's made things a little bit more difficult. Rents have gone up, all those different things, all those opportunities that were there seem to be lacking at the moment. Now, what I think that as membership bodies we need to do is, as I say, listen and learn from our members, from the frontline workers, from each other. You know, we need to learn what's going on in Northern Ireland that Nicola's dealing with, what Katie's dealing with in Wales, and what Michelle's saying in Scotland. And as a collective, we need to work hard together. And I think that's where what St Martin's do in pulling us together in that sense is really, really positive. But we need to use it. We need to create the resources. We need to create, from my point of view, the training, the support. We need to ensure, you know, that gratitude and better support from senior management is ingrained within the leadership courses that we're doing, that Anita mentioned in the chat earlier. Those are all things that are within our gift, but we need to make sure that the frontline workers have the opportunities to participate in those things. They don't need to be, we don't need to create barriers, because if we get people through those different things, in that we learn, and in that then we use it to influence what we feel needs to happen in terms of the policy world, which was the second part that you said. We've seen through our campaigns that we can make a difference. You know, we did the Support Don't Deport campaign a year ago or so, and you know, that didn't land necessarily brilliantly initially with regards the government, but actually what it did do is make people think and talk about stuff, and things changed as a result of it. And that was with regards the way that the immigration process and things were working at that point. And then finally, I guess another thing that's just a great example when you talk about collective action. You know, I'm chair of Expert Link, which is a wonderful organisation that pulls together and works with people with lived experience. Now, they are now supporting the rough sleeping element in government, and acting as an advisory panel with their network members to inform what's going on, certainly with regards to the English context. Now, I know how valuable that's been viewed and the difference that it's made, but actually it's a group of real people who've experienced homelessness and are using that to help ministers to learn. And, you know, ministers get a bashing at times, and probably quite rightly, but actually they do at times listen, you know? And I think we've got to continue to ensure that opportunities like that are happening are informed in the right way, so that it makes the impact on the people who make those decisions. So in that instance, we need to make sure that those people with lived experience have that opportunity, have the ability to be able to get to those things, because actually they will describe things so much better than I could.
Pete, thank you so much for that. And I know what comes to me loud and clear is something that you know, those who've heard Darren Garvey, or you know, read his books, is about the idea of social distance, and about trying to collapse social distance and sensitize very busy and sometimes closed-minded or cloistered politicians, budget holders, decision makers, with the stories and experiences that really bring to life. You know, data counts for a lot, but you know, the question that I'm sure we all think about is, you know, there's data around, you know, public health impact, there's data around public finances and political economy, but how far can that go to really making, you know, sustained change, and thinking about changing the framing of how people are receiving the messages, and indeed what are asks about acting on. It's a really important point about lived experience as well. You know, one of the things that came through for me from the survey, 16% of frontline workers who responded to us had lived experience of homelessness themselves. That certainly goes into informing vocation, dedication, and empathetic and relational practice. What we also know, and this is something that we found out this year, is that almost a quarter of frontline workers are worried about becoming homeless themselves, at least sometimes. And, that's something that, we know comes up in previous surveys that Homeless Link has done. And also Katie comes up in research that Cymorth Cymru has done. I want to ask of you, Katie, thinking around the sense of commonality or solidarity between frontline workers and the people they support, people experiencing homelessness. I'm aware that your organisation has achieved significant change for wages for the frontline workforce in Wales. I want to know how you went about working together, again, the collective action to secure that pay uplift. And also about if there are any lessons then you think that are applicable in other contexts, other geographies about ensuring a fair wage, and how that touches on bigger issues of organising and trade union activity even. Again, the commonality of experience about in-work poverty and being at risk of homelessness as much in the frontline workforce as it is amongst the people who are receiving support.
Yeah, absolutely. Thanks very much. And I'll start off by saying we know that we're very lucky in Wales compared to some other nations in that we still have what was called the Supporting People programme, and that remains ring-fenced, so distributed by the Welsh Government to local authorities, but ring-fenced so that it has to be spent on homelessness and housing support services. And that's now called the Housing Support Grant here in Wales. And that very much over the years, the lack of funding, the funding cuts has driven down wages. It's not because organisations don't want to pay more, it's because the funding cuts and the commissioning processes have driven down those wages. And, as you said, ourselves and the St Martin in the Fields Frontline Network have done lots of work in understanding the poverty facing frontline workers, and we've all shouted very loud about it. We were approaching the Welsh Government budget settlement for 2024-25. Ministers were saying it was the worst budget that they'd faced since devolution. So they were going to be having to make very difficult decisions. So we knew that the budget was at huge risk, and that comes with the risks for service provision, but also for frontline workers and the rates that they get paid. So we've been campaigning on this since September, primarily on the risks that we'd found around service closure. We got to the draft budget in December, and we had a cash flat budget for the housing support grant, which on one hand was far better than many other areas of the government budget, but also wasn't good enough, and we were very clear about that. One of the things that we have in Wales is a Welsh Labour government that has stood on a manifesto of commitment to fair work and the real living wage. And they made a big pledge in their manifesto in the lead up to the last Senedd elections that they would pay all social care workers the real living wage. And we got a commitment that would include homelessness and housing support workers as well, both before the election and after the election. But we haven't seen that happen. We've seen that commitment be rolled out for registered social care workers, but our sector has been left behind. So we thought, if we're giving you figures about service collapse and you're still not increasing the budget, what else can we look at? So we decided strategically that the Welsh Government's commitment to fair work did not match up with the experiences of workers within our sector. So we decided to focus on that. So following the draft budget, we collected data from our member organisations about staff wages. When you talk about collective action, the importance of our members sharing that information with us and trusting us with that information, which is very sensitive, both commercially but also reputationally, but they trusted us to do that. And that showed us that 41% of the sample that we had, which was over 3,000 workers in Wales, 41% were being paid below the minimum wage that would be coming in the following April. So perfectly legal at the time, but in terms of that challenge for providers and the wage increases they would legally have to pay, already 41% below that. And, you know, that in itself is absolutely shocking, given the skill and complexity of work that these workers do. And 67% being paid below the real living wage at that time. So met the Minister for Housing in January, briefed her on this. She's very supportive of workers' rights within this area, but is kind of has her hands tied behind her back in terms of how much money the Finance Minister give to her. And I kind of gave her a bit of an ultimatum, really. I said, look, this isn't good enough. It's absolutely unacceptable. And if we don't see movement on this in the next few weeks, then I am calling out the First Minister publicly on his commitment to fair work and the real living wage. So we wrote to the First Minister and said, look, this is your commitment in your party manifesto, in your personal leadership manifesto when you stood for leader of Welsh Labour. And this is the status. This is what the data is telling us. You're falling far short of this, and you need to provide more money into the housing budget to enable these wages to be increased and meet your commitments to the real living wage. We gave him time. So, you know, most of you have probably got this, you know, oh, you'll get your response within 17 working days. So we said, look, here's the letter. We'll give you your 17 working days to respond. And if your response is not good enough, then we're going to go public with this. Time ticked on. We weren't getting a response. So we worked with ITV Network News, briefed them on this situation, briefed them on all the manifesto commitments, the programme for government commitments, and then the data that we had that showed the Welsh Government was falling far short. We also met with Plaid Cymru, who were at the time in a cooperation agreement with the Welsh Government. So not in government, not in coalition, but a cooperation agreement that meant that Plaid would support the budget passing through the Senedd. And they were very committed to the real living wage. So they were briefed. We got to the day and no letter from the First Minister. So you can imagine my anger levels really ramping up at this point. So we decided to go live with the media coverage, with the pressure in the Senedd. And that's not a decision you take lightly. Going for the First Minister, who is a good man, is a principled man, you know, is not an easy decision, because you also potentially burn bridges left, right and centre. And when you've got a government of the same colour for 25 years, there are inherent risks of going too hard. But for me, and especially running the Frontline Network Wales, speaking to frontline workers all the time, I'd had enough on behalf of frontline workers. I'd absolutely got to the end of my tether. Enough is enough. We're doing this because it's the right thing to do. So we went live. We got some awful, pathetic response from the First Minister in his letter, which didn't recognise the commitment we referenced, and, you know, and didn't even mention homelessness workers till the second page of the letter. So, you know, the anger's ramping. We went live with media. Plaid Cymru attacked the First Minister in First Minister's questions in the Senedd. They then really challenged the Minister for Social Partnership in a statement about Trade Union Week, and then also attacked the Housing Minister in her questions the following day. We got coverage on UK News, a bunch of the Welsh news websites, Housing Press, etc., and really piled on the pressure there. So it blew up on social media as well, and I kind of went on and challenged some of the answers the First Minister had given. So really kind of overstepped that line, really pressed the nuclear button when it comes to really going for a government that we work alongside a lot on shared goals. So we waited a little bit, and then we got the call about the final budget, and the Finance Minister had allocated an additional 5 million to the budget, and the Housing Minister had managed to find an additional 8 million from elsewhere within her budget. For me, 5 million from the Finance Minister, bit pathetic, not really good enough given the scale of challenge, but we'll take it. But full credit to our Minister, who fought really hard in the Cabinet. And I think, you know, probably won't say publicly, but appreciated all the pressure that we were putting in, because that, of course, helps her to fight within that Cabinet. So in total, an additional £13 million, which equates to a 7.8% increase in the budget for the Housing Support Grant, which in that budget context was miraculous. But it really spoke to the collective action. You know, I might be the person that's on the news having a go at the First Minister, but it's everyone. Like, you know, if we don't have frontline workers writing to their members of the Senedd, if we don't have organisations sharing their data with us, we don't make any of this happen. So a real collective action. at that point, we would have liked to have a lay down and a rest then, but the next battle is making sure that gets to those services. So we'd been, even though an increase seemed really unlikely, we'd been briefing officials saying, look, if there is an increase, it needs to be for pay. Otherwise, it'll just disappear into nothing. And we know what we need. It's about stabilising existing services and increasing pay. So the great news was the minister wrote to local government and said, this is the increase and it's primarily for pay. Make it happen. We then contacted local authorities and said, look, this is what the minister's saying, and the easiest way that you can do this is just pass that 7.8% on to all existing contracts. We also need you to do this, and again, this is where the collective comes in, because for any organisation delivering across more than one local authority area, they need to have the same uplift everywhere. Otherwise, they can't pass on the increase. They have a flat salary structure, so all of you need to do exactly the same. The responses from local government ranged from, yes, that sounds sensible, to how dare you tell me what to do with my money. But we have continued liaising with Welsh Government. Welsh ministers and Welsh officials have re-emphasised the message in meetings with local government. I've been collecting data this week. We've had some remarkable U-turns from some local authorities who on day one said, you're not getting any of it, to now have miraculously decided to pass on the 7.8%. There are still few outlying, but I met with the minister yesterday. I shared what data we'd collected, and we'll continue to exert that pressure until as much of that money as possible gets to those organisations and gets into the pockets of frontline workers. And the great thing is the journey doesn't stop here. In the minister's letter, she said, I see this as a critical point, kind of moving towards the adoption of real living wage in homelessness and housing support services. So we continue to do other work strategically with Welsh Government to try and get to a place where this is recognised. It won't be easy, but we're really committed to it. And I invited the minister yesterday to make this one of her legacies. You know, in this post, I said, we can achieve something here for the workforce. I'd like this to be one of the things that's your legacy when you leave this ministerial post. So we'll keep fighting, and hopefully collectively, as I say, we can make that impact. So good start this year. It doesn't solve all the problems, let's be clear, but it's a good first step forward.
Katie, that's absolutely fantastic to hear, and really inspiring as a campaign. You know, what it really shows me is about from where you derive your mandate to speak up and speak out. It also sounds as though they're, you know, in addition to the very tangible and hard fought for increase in salaries, there's also something about the empowering effect for the workforce and for organizations in taking that collective action, thinking at times we're being criticized. Are we doing the right thing? Should we stick with it? You know, someone in the chat here said, you know, good on you for standing firm. And I think that really shows in getting that success, but also about the tenacity in any campaigns across the sector, for the workforce, or for people experiencing homelessness, is about keeping on going and having a very clear sense of mission, of values, and the mandate. So that's fantastic to hear.
And I get that from the frontline workers that we engage with week on week. You know, I'm not afraid to say that my mental health took a significant hit towards the end of February. It had been a long few months and it was really hard. And I, at one point, didn't think we were going to do it. But the strength that I get is from all the people that we represent who do incredible jobs that are far more difficult than mine every day, don't get paid or recognised well enough. And that's what motivates me and keeps me going. So, and it's a privilege, it really is.
Thank you. And I think that, you know, for sharing that kind of candid and personal reflection as well, it chimes with a lot of what we've heard on, you know, from frontline workers within the sector, as well as managers within the sector. 92% of them said that the work that they're doing is making a difference. That's incredibly high. And I think the nexus between that sense of purpose, commitment, and satisfaction, where the friction is about whether people are feel able to continue doing their jobs, given the pressures, because there is nothing but a sense of commitment and a willingness to keep on working. But it's
James,
about the challenges.
James, could I come in there? Just
yes, please, Nicola.
Well done, Katie. Absolutely incredible. And to hold your nerve as well, because it's really challenging for organisations like ourselves who rely on government funding, you know, to put up that. I mean, we do constructively challenge, and we do work on partnership and support. But there is a fine line sometimes, and you need to know when to cross that and when not to. We also have supporting people funding here. But that budget's been ring-fenced, which back in the day before my time was celebrated, obviously, because there was obviously a major concern that could slip into health. And if it goes into health, as we know, you feed the beast, that it'll just get lost. So my predecessors and organisations and staff have worked, a big shout out to them for actually getting that fund ring-fenced. But the negative side of that is then whenever it comes to the budget, so go back to that baseline figure. And obviously our costs are increasing. So there's that squeeze that's put on the vast majority of our members are charities. And there's an expectation that we then bring in additional funds through fundraising to help support what is a statutory function. So we were in a similar position to Wales. And we were concerned there might be actual cut to that ring fence budget. And we did a lot of lobbying through Mark Bailey's our policy lead. He's on the call. He did fantastic sterling work, much more behind the scenes, as I say, Katie. But just made sure that we spoke to as many people as possible, that we did a lot of press stuff in housing press and other, that this was raised at the all-party group on homelessness, that there was a lot of talk about it. So people were talking about it. But at the same time, honestly, we're really concerned that services are going to be handed back, because we knew that there's a number of organisations who were saying, right, the boards are saying we can no longer run our business at risk. So what actually happens to those people when those contracts are handed back? Because nobody else is going to take them over, So, and similar to your situation in Wales, we haven't got all that data on staff salaries, but we did do a bit of a snapshot kind of survey, and there's major concerns in the sector that they couldn't meet the minimum wage increases. And the same is going to happen next year. Now, whenever the minister, and we met with the minister, and the minister came to the all-party group, and people who lived experience and challenging the minister, and we were very fortunate to get a 6.8% uplift of 4.4 million, which isn't enough, but we'll take it, Katie. Do you know what I mean? However, while that's been celebrated, at the same time, I'm going to meetings. I was at one yesterday where I'm here, but we don't actually know how that's going to work its way out. So we want to see the uplift going to staff salaries. But again, the housing executive minister saying, well, we're going to have to look at deficits here. We're going to have to look at where they're starting. We're going to have, and I'm not knocking it, but we need to have that open and honest conversation about paying our staff, for goodness sake, a living wage, so I'm sure everybody would be in agreement with that. But why do we have to fight so much for it? It's really, really frustrating. One of the things that our members say to me is, well, we're not a unionised sector. If we were, things would be slightly different. But fair play to you, Katie, for holding your nerve on that. And I'm sure it did impact you, because it's quite scary at times when you're having to take all that on board as an organisation. But we shouldn't have to fight. We shouldn't have to put up this fight, because it is exhausting. And what would happen if our sector wasn't there? Which is a big question I would ask. Yeah,
and that really holds true. And thinking around, there's going to be a discussion later on around the legal aid sector. It's about the knock-on of burnout and people leaving their jobs, around not being able to retain, but also not being able to recruit in, and the impact on those, to use a probably inappropriate phrase, about those left behind, working to deliver services when there are service closures, when there are mergers, and when there are simply just unmet needs. Michelle, I want to ask about the context in Scotland, but framing it in the way that, understanding that there have been debates around the declaration of a housing emergency in Scotland. So writing around about climate action, Naomi Klein said that the first stage for that was to name the emergency, about climate emergency, because it's only once you're on an emergency footing as civil society and as a sector that you can find the capacity to do what is required. Thinking around individual and organizational capacities of organizations in Scotland within that context of the housing emergency, how can and do frontline workers find that capacity when the challenges are so great?
It's a great question, James. Just a bit of background, I guess, for context. So in Scotland, our Scottish Government just recently has declared a national housing emergency. This was kind of brought to the fore by Shelter in November, where the Scottish Government declined to declare a housing emergency, which kind of triggered subsequent local authorities to start declaring local housing emergencies. And I think the question around about the defining the emergency is really key in this conversation. So when I was catching up with colleagues in Scottish Government earlier in the week, I was enlightened that those local authorities, it's now a third of local authorities in Scotland have declared their own local housing emergency, and nationally the Scottish Government has acknowledged that across the country. But each local authority has declared a housing emergency on a very different basis. So Fife, for example, is quite a tourist area. It's a mixture of rural and urban, and they've declared a housing emergency, my understanding, is based on things like second homes. Glasgow's housing emergency is almost entirely driven by accelerated asylum decisions from the Home Office, which has had a really massive impact actually on how the council can provide temporary accommodation, and has led to a huge overuse in hotel accommodation, which we know is not a great place for anyone to try and rebuild and live a decent life. Edinburgh, there's just a complete lack of temporary accommodation, and the affordability issue there is quite particular as well. So when we're thinking about defining what that emergency is, I think the emergency for frontline workers is going to be slightly different to the kind of larger context of a housing emergency, or of homelessness being at an individual level, obviously an emergency in itself. But for me, there's something quite, and this may make me sound very naive, but I don't mind. There's something about this that does make me feel quite optimistic, cautiously optimistic, that we are now operating in a kind of acknowledged context of emergency, because the housing and homelessness sector, as we all know, has been criminally underfunded and defunded over a long period of time. The rate of building social homes or affordable homes in Scotland has just not kept pace, and this can't come as a surprise to anyone that this is the situation that we end up in, as bleak as it is and as awful as it is to imagine that people are going to their work, which is a vocation, to help people improve their lives and find a place to call home, but are actually finding themselves at risk of homelessness, and that the majority are saying that that role has a negative impact on their well-being. That's tragic. But I'm not expert enough to say, is that the emergency part? So there's a part of it that I think is really key for everyone as part of this call, and everyone who is engaged with that frontline workforce, to help define what is it that's the emergency. Is it that we're now seeing people on, this is very crass, poverty wages, struggling to help people through a system? Or is it the emergency that this workforce itself has been completely undervalued for the work that it does? Do you know, so there's something for me in there about the importance of defining exactly what that is, to then direct our influence into the right places.
Yeah, Michelle, thank you so much for that. I think one of the things also that you touch on is around the differential impact and experience for different kind of categories of people, and in different places as well, some of the specifics of the context. There's something also in there that I was thinking whilst you were speaking, is around low earning households having housing costs that are 50% higher than they were 20 years ago. We know that low earners spend much more of their income on housing costs, not only than 20 years ago, but than people with higher incomes. And I wanted to bring in the other members of the panel to talk around diversity, inclusion in as much in support services as it is in the understanding and the mobilization. There's a question in the chat about in the Q&A around care experience as a protected characteristic, recognized now in over 90 local authorities. But I'm very mindful that in what we have spoken about today, and mindful about the data and evidence that we've collected in our Frontline survey, that we've made the commitment to, in future years, try to gather better data on diversity amongst the frontline workforce, that there is a differential impact of the housing crisis on minoritized and racialized groups. There's a differential impact of poverty on women, and aware of the intersections of different identities, and thinking around the demographic makeup in each of the four nations that are represented. Just want to invite members of the panel to talk about how we can be more inclusive for providing extra support for diverse members of the frontline workforce, as well as for people experiencing homelessness who are subject to multiple barriers and even higher barriers to long-term solutions to their housing situations.
Do you mind if I come in first there, James?
Thank you, Pete.
I think there are a few things with it that really resonate with me. I mean, I'm certainly by no means, as I've said at the outset, an expert in these kind of things. Everyone has their own individual experiences, and I think that ultimately is the most important thing to understand and actually value, because I think what we need to do in this space is to basically we talked about person-centered, we talked about relationship-based approaches. We need to understand and recognize that people are individuals, and they're wonderful individuals with brilliant similarities, differences, all those different things. However, we're still working, I don't know how many years behind around the likes of commissioning of services, actually listening to people and hearing the insight from them. Now, that's partly with regards, obviously, the people who we're supporting, those with lived experience. We've done a fantastic piece of work in our practice development team around gender-informed approaches, and I think it's worthwhile people having a look at that. And that's, I think, the challenge for the sector as a whole, to start questioning why and how they're doing things. And the way that they can do that better is by using the knowledge and experiences of the frontline workers to truly kind of embed that within what they're all about. We've heard about trauma-informed care, all the rest of it. A lot of that ends up being talked about from what it means for the individuals who are using those kind of services. But it's equally important with regards to the staff, and it's equally important that they are supported with regards to that and what comes out with it. I always talk about, when I was a frontline housing options advisor in a Northeast local authority, that we are a unique bunch, people working in this sector, because you'd very rarely hear a positive and happy story, and we need to really, really make sure that when we do, that we understand why that's the case and actually champion it in terms of making sure that people understand that there is positive in the work that people are doing. But in terms of that, as I say, diversity bit, it's looking as individual organisations of what they can do. We've got a resource for leaders to look at in terms of where they are from their point of view with regards their assessment around equality, diversity, and it's starting to talk about it. And one thing that I think's been really positive that I've seen in Homeless Link is we've created a number of resonance groups for people who would say that they have different kind of characteristics, and that's the peer support bit. There's an opportunity for people to connect and to share their experiences without it being a part necessarily of anything particularly formal in relation to the organisation. We want to learn, we want to listen to it, but we're not also expecting anything from them. We want them to feel like they can talk about their experiences in a way that is, empathetic, positive, supportive, celebrated. But then hopefully, because we've got an EDI working group that then comes through, we're not, as I say, where we would ever want to be. I don't think you never will be. You've always got to keep improving with these things because, again, experiences change because of new things coming in as well. We've got to keep this on the agenda. And in terms of the support for the workforce, we need to make sure that it always has that kind of lens of equality and diversity within it. And that comes to learning styles as much as it does any other kind of characteristic, because we know our workforce, brilliant people, but they have different kind of ways of learning and it resonating with them to help them feel like they're doing something in the way they want to.
Yeah, and a big question that we ask ourselves here at Smart in the Field charity is about who's missing from our program reach, the voices that we listen to, and the users that we collaborate with. Katie.
Reflecting on the diversity question, I just think we all need to do better. I think too often people say, oh, that's a little bit too difficult, or we don't have the data, or we don't really understand, so let's focus on the sort of mainstream approaches and we'll think about that later. So I think there's something about leaders being accountable and holding each other to account, and just because it's difficult doesn't mean we shouldn't do it. I think there's a number of things happening in Wales where we're trying to make some steps towards that. So we've Welsh Government's recently published a strategic outcomes framework to end homelessness, and ourselves and fellow organisation Type Alb that focus on equality and diversity have really kind of fought hard within the working groups for data to be collected on equality, diversity, protected characteristics, so that we understand the different experiences and outcomes that are affecting people from different diverse groups. So the data is just so important. Otherwise, we're just working off anecdote, and we need robust information to make those decisions. We've also got an anti-racist Wales action plan, which was sort of the Welsh Government's response to, I guess all of the focus that was on institutional racism, on the racism worldwide, and the movements that were created around that. And there's a chunky section in that that's focused on housing, and so there's a number of very clear actions for the housing sector, whether that be Welsh Government, RSLs, local government, third sector, on increasing representation of diversity at all levels within organisations, making sure that the services meet the needs. And I think sometimes when we see budget cuts happen, we see merger of services, of contracts, which pushes out maybe smaller, diverse service providers who actually have incredible trust and histories with people within diverse communities. But as soon as you merge together 4 different contracts, they can't compete against the big housing association against that. But big housing association probably doesn't have that kind of diverse provision and that trust and relationship. So there's definitely stuff that we see in terms of funding cuts impacting on the ability to meet the diverse needs. And there's also stuff in that anti-racist Wales action plan about the private rented sector and also voice and influence. And I think the voice and influence stuff is really important, but going about it in the best way possible, and involving communities and not dictating to communities how they should be engaging is really important, but also resourcing those organisations that represent diverse communities to do that, not just asking them to share their trauma for kind of no return. Let's make sure we're resourcing them properly to do that.
Thank you. And Nicola, Michelle, I invite final thoughts on that particular issue around protected characteristics, solidarity, and diversity and inclusion.
I think in Northern Ireland we really need to and should be doing this much better. Again, I go back to the budget position that Katie was referring to, and my worry is always that when budgets are squeezed, that's whenever those with protected characteristics and ethnic minority backgrounds and minority communities often are overlooked. And I think the challenge for us here, because we've such a, in particular, because we've such a small population of ethnic minorities, and we're seeing more people coming into Northern Ireland, it's the attitude of people in communities whenever services are stretched. So what you often will say is racism. I mean, that's what it is, and we're seeing higher levels of it, which is a major concern within communities, because there's not enough housing, there's not enough services for people, who've grown up, who live here, never mind other people that, we know the arguments around that, and we know the real issues around that.
Yeah.
So we definitely just need to be doing more, and I think we can learn more from our colleagues across the nations on how we go about actually doing some of this work on the ground.
Thank you. And Michelle, any reflections thinking around demography and collaboration and challenges as well as successes in Scotland?
Yeah. I think for me, it's about just being brave enough and being willing to put yourself out there and really make the effort to address the inequality in the sector, and obviously the part of that is underpinned by people who have different experiences and are from different places and different backgrounds. I think that we are maybe not necessarily the best people to have the answers, and the people who are in these frontline jobs who are maybe experiencing more challenges because of their ethnicity or because of their sexual orientation, those are the people that should guide on how we improve that experience and make it a more equitable experience for everyone.
Thank you. That's really powerful contributions from everyone. I think important to front up with our considerations around equity, diversity, and inclusion in all of the topics that we'll be covering over the course of today. I've got nothing but gratitude and thanks for the contributions that everyone on the panel has made, looking at successes, looking at just how tough and how demanding, but also just how brilliant and dedicated the work of you, your colleagues, and all of those organisations working across the four nations. I wish that we had plenty more time for this. Obviously, we'll go into many more discussions on different themes as the course of the day goes on. Looking forward as well, we're aware that if the polls are to be believed, we're up for a decade of renewal that the Labour Party here has promised. So to try to end on a hopeful note, many people I know feel across the front line that there's been a situation over the last decade plus of being, frogs in boiling water. But I think the stubborn optimism and the hope and the dedication and all of the brilliance that everyone's shared today, that's a real motivator to keep on going. I've eaten in, unfortunately, 3 minutes into the break. We are due to reconvene for the morning sessions at 11:45. So we're going to say goodbye for now. Thank you very much to the panel, and look forward to seeing many of you in the sessions later this morning. And I'll be back online after lunch to join in for the discussion around wellbeing. Thank you so much, everyone. Take care and good luck.
Thank you. Enjoy the day.
Bye.